Hi guys, my name is Dr Mani. I'm a hair transplant surgeon, and today on our channel we have got Nico. He had a surgery with us over a year ago, and he's come back to share his results, but also talk a little bit about his experience. So, Nico, yes. Thank you very much for coming on and having a conversation with me today. How are you doing?
I'm good. Thank you for having me. I think last time I was here, it was in the old office, so it's good to be back. We got a big production crew now, so it's good. I'm enjoying it. It's good to see you.
Good to see you too. Let's go straight into it. You know, firstly, your hair looks amazing.
Thank you.
Yeah,
Thanks.
that's the reason why you came to see me in the first place. Hair's looking sharp. You're looking sharp. Tell us a little bit about your journey into getting a hair transplant surgery, but all the years that built up to that singular moment.
Yeah, so for me, it was something that I noticed for a while. I knew that I was losing hair. I knew that my hair was thinning. Not something that I was really comfortable addressing because you can hide it in your own way. And everyone's story is different. So for me, it was more of something that I was self-conscious about, knowing that, hey, at a certain point, a hair transplant, it may be something that I need to do, or I was looking at some kind of, over-the-counter, some kind of like medications that would be helpful. But then at a certain point, I figured I wanted to take the next step. I knew that I had looked up some videos, and a lot of the times that people would say, like, now is the best time to do the hair transplant because you're going to get the best results as soon as possible. And of course, there are hurdles that you have to overcome throughout the process. But for me, it was something that I wanted to take that leap and get the best results. I didn't want to just take the path of medication and leave it there. I wanted to really maximize my own results, and I know that doing the hair transplant was the way to do it.
It's really interesting that you say that. What I typically find is a lot of patients, they start off in the same manner as you. You normally do a Google search, or I'm noticing a little bit of hair loss. What can I take to improve my solution? And often people want the silver bullet, right? Hopefully I can take this medication called finasteride and it will magically grow my hair back, or maybe I'll take oral minoxidil. And a lot of people keep it a secret, right? They don't tell people that they're doing these things, and they suffer in silence. Would you say that you were sort of that sort of person? Were you kind of doing like online research, trying to figure things out yourself? Because there's a lot of misinformation out there.
Yeah, there's the misinformation, and I was doing like the biotin and collagen, and that's where I started, because finasteride, it wasn't something that I found. I didn't want to do the HIMS. I was kind of ignoring the problem.
Yeah.
But yeah, it was something that I would do on my own. I didn't want people to know. And like some of the friends that I knew that had that were losing hair, maybe they were the ones that I would speak to, because I was like, hey, are you taking anything? What are you doing? Are you using anything? And that's who I would approach. But as I got more comfortable, with my situation, I started speaking about it, and then ultimately that's what you had told me when I spoke with one of your older patient or your prior patients. He had mentioned to me, I spoke with him on the phone. You had put me in touch with him, and he had said, "Oh, I was just open about it. I told my colleagues that this is what I was doing." And for me, that was a hard part to do. But I think once you tell one person, it's not as big of a deal as I had really made it in my own head.
Yeah, it almost becomes a bit of a snowball effect, because other men are also suffering in silence, right?
Yeah.
They're keeping it all locked up. And I think you said earlier, actually, it was like, one of my mates came over to me and said, "Hey, I heard that you had a hair transplant, Nico."
Yes, sir. Yeah, he did.
These are the kind of conversations that people will typically have with people that they know that have had a hair transplant surgery, and I find that fascinating. In the lead up to the surgery, or in the lead up of doing research to the surgery, did it affect your confidence, the hair loss? How long did it take for you to get to the stage where you actually felt, now is the time for me to do something? And I suppose, what made you pull that trigger? If we could sort of go into that.
Yeah, so for myself, I think back in, like now it's 2025, and the first time that I had been told that my hair was thinning, it was at like some barber in like Los Angeles. He was like, "Oh, your hair's thinning up top," and this was like 2015. I was like, "This is not what I need to hear right now." But that was the first time that I was told, so maybe 10 years ago, and then I would kind of like address the problem by shaving my head every now and again, just doing the buzz cut. Like, is this something that I could get comfortable with? And from there, it was like, okay, if I need to do the bald look, cool, I'm comfortable in that skin. And I had shaved my head now in maybe like 2019. And this was when I was playing football in college, and my teammates, they were like not poking fun, but they would be like, "Oh, you're losing hair." It wasn't obvious when your hair is long, but when it's shaved down, you could start to see, there's the line of your hairline. So that was another stage where I was like, again being put in my face, and of course I already had known this. And ultimately, now it's I had the surgery in 2024, and at the time, I just wanted to commit to what I had been suffering is an extreme word, but
no, it's not though.
I wanted to commit to what I had been suffering for so long. I was like, if I want to not get rid of these thoughts, but if I need to take that step.
Yeah.
And so I had done the research. I wanted to stay local, and fortunately you have a practice here that had like excellent reviews. You were open to putting me in contact with prior patients, and I know that's somewhat of not of a risk for you, but it's something that your patients, you have a relationship with them. It's not something that you just do. You clean your hands. You're on your own now. It's you maintain the conversation. Which for me is something that I didn't know before, coming to your practice, but it's something that I had heard about from your other patients, and something that I'm very happy of why I came to your practice.
Yeah, I mean, look, I think it's a very interesting story, and I think a lot of men would probably feel like they're in the same boat. When you start losing hair at 18, and you've been used to having all this beautiful hair, and you're a good-looking man, right? Mm-hmm. So you're lucky in one regard, but when part of your hair starts to disappear, it starts to affect your personal identity. You start to do things like shave your hair off regularly, find yourself under a hat more regularly, try and do other things like grow the beard out a little bit longer so that it masks the fact that you're losing hair on top. And ultimately, it can affect people in social situations, Friends are obviously going to be poking fun. That's what lads do, eh?
Of course.
They're going to make a little bit of fun. My friends do the same thing about me. I'm short and I'm fat. It is what it is. And I think they remind me of that constantly. Unfortunately, I can't do anything about being short. I can do something about being fat. And you kindly actually mentioned that I look like I've lost some weight. So, friends, stop poking fun at me. But from my perspective of things, if you're in a position where you can do something about something that's troubling you, right? Financially and mentally, and you think that you've picked the right person to do that with, then 100% you should do it. Otherwise, life is full of regrets. It's like, if I, would I, could I, should I? And I don't think people should, life is too short. Yeah. Don't live with that ambiguity and do something that really is going to make an impactful difference to you. So, did you think it affected yourself in terms of social interactions when you was losing the hair? Did you find that, I'm sure you come across a very confident guy, so it probably didn't make a difference to you, but when you'd go on a date with a girl or anything like that, did you find that it made a difference to how you presented yourself? Yeah,
I would say, it was only when I had had shaved my head that I was, conscious of, it's very visible that I'm losing hair. But I think in my case, it was more something like where I was maybe making more of a problem than it really was in reality. And maybe it's because people had poked fun at me too much. And it's not like it's all in in spirit, right? Yeah. But everyone, for me, that was something that I had been struggling with myself for some time. Nothing that was like exuberant, but it was something that I wanted to address. And then in terms of confidence, I think I would say, yeah, like I honestly forget back in the day, but in terms of confidence, it was more something when I was, looking in the mirror, I was like, oh, wow, this is for sure something that's going on. And I was looking to maybe just make a change, do something.
Radical.
Yeah, yeah.
Okay, well, tell us a little bit about your research phase then. So, okay, you've now got to a point where I want to do something about it.
Mm-hmm.
Right? I'm financially able to do something about it. It's got to the point where it's affecting me on a day-to-day basis. How did you, I'm assuming I'm not the only surgeon you ever spoke to, or the only clinic that you ever spoke to. So how did you go about the research phase, and then how did you decide to zone in on me specifically?
So the research, I would say there are two ways to do it. Maybe I'm sure there are more, but the way I thought of it was either I do it overseas or I do it in London, where we're based. And I knew that I had gone on YouTube, I had looked up some videos, and they felt a bit like cheesy in my opinion. And it just, I knew that, and it may be cliche to say, but you're like when you pay a premium for something of quality feedback or quality results. And that's sort of where I started with overseas or local, and then that kind of differentiates between something that's, call it premium, or on the cheaper end. And anytime you're doing some kind of surgery, because it is somewhat of a surgery, there's no way in hell I'm going to be doing something that's on the cheaper end, right? And I want to be in the best care, because this is something I'm putting myself through. Yeah. It's not something that like I need a surgery to break a bone. It's something like I want my hair back.
Yeah.
And from there, I had come across your clinic amongst some others, and it was more of like looking through the results and the images, the videos, looking at your social media platforms. And not only did you have your old patients, but you had information, you had educational content, you were well informed about what you were speaking about, and I think that was something that I sort of gravitated towards. Was doctor, you want to educate people. Yeah. It's not just you want to get patients. It's hey, I'm here to share knowledge. Yeah. I want to make that knowledge free to anybody who is looking into that. But ultimately, I came across your practice amongst others. I had filled out the what is it, like inquiry, yeah, the inquiry, and I liked that the cost of the inquiry was applied to the surgery. In the grand scheme of things, it's like a fraction. But I was like, okay, well, if I go through with it, at least that deposit pays for something. So that was something that I thought was great too. But ultimately, I knew that I wanted to do it locally. I didn't want to go overseas. And the cost point is something where often if you're paying more for a surgery, you're doing it by someone who knows what they're doing. And I can like confidently say that Manny knows what you know what you're doing.
Sometimes. Sometimes. I mean, look, I think this is again a very interesting concept, cost. Specifically, and we'll talk about cost because I have a spectrum of patients. I have some patients who say, Manny, for the life of me, I can't understand why you're so cheap. And then I have the other side, which is, Manny, I can't understand why you're so expensive. Because what people end up doing is they shop around, okay? They're not doing what you said, which is very, very important, actually. It's thinking about the level of care that you're going to receive, the quality of the aftercare you're going to receive. And we're going to talk about your aftercare because you went MIA. But we're also going to, how is it that the transplant is going to pan out? In the worst case scenario, let's say you have a complication. Is the person that performed the surgery going to be able to fix any issues that arise from it? These are things that people don't factor in. They just see the magic of a potential hair transplant surgery. And I think I said this to you in consultation, when I do a hair transplant surgery, you're going to think that I'm a magician or a wizard once you get the hair back that you want. And I don't say that callously. I say that because I actually mean it. And I know that based off of the donor that I'm looking at, it's it's possible.
Yeah.
Yeah. If I didn't think it was possible, I would say to you, it's not possible. I'd be frank with you. I'd say, Nico, I've had a look at your donor area. I don't think this is the right approach for you to take. And so that also plays into the cost side of things. And I suppose it also depends on who's doing what part of the surgery. I was very hands-on in your surgery, like I am with most of my surgeries, right? I do all the extraction, I do all of the incisions, and I'll sit on there and I'll implant the fair few grafts. And you're the only patient I operate on that day. That comes with a cost, right? But people don't see that. They just think, oh, it's a hair transplant surgery, I'm getting it like anywhere else. But they're not. Sometimes one doctor will be looking after 5, 6, 7 patients coming in, marking their hair. What's your take on that? So, I'm sure you spoke to other clinics that almost ran it a bit like a mill. If one surgeon is looking after 4, 5, 6 patients, how would you, still paying a substantial, because it's London, right? They're still paying a substantial amount. How would you feel about that?
Yeah, I wouldn't be as confident as I was. I liked having your focus the whole day. And I liked the concept of, hey, I'm coming in, my name is on the calendar that day. I'm the only one that's being in focus. I'm not like an egocentrical person. But I think to your point earlier, it was more of like, when we did the consultation, it was a video, right? But then I came in to draw the line to make sure, hey, if we're going to go with the procedure, let's draw the line, let's make sure you're comfortable with what you're going to get. And I remember you drew the line, you looked at the donor area, and you said, okay, how do you feel about that? Is that something that you would be happy with? And, originally I was like, well, wouldn't it be nice to be a bit lower? And you go, no, if you want it lower, this is what I've done. This is going to be the best. You're going to have the most quality grafts in a condensed, in a concise, condensed area for the best results. And that's when I think you drop the line of that you're the magician, right? And so I liked that you were honest. You said if this is not something that you're going to be happy with, then I might not be the guy for you. And I was like, okay, well, this is reverse psychology.
It works.
But I like this, and the fact that you made me understand that, hey, the hairs are not going to sit well if we're dropping the line down.
Density,
I ultimately,
it has an impact on density. So you got to remember, we're putting a certain number of grafts in a square centimeter area. And you might have all the beautiful triples in the world, but the lower we go with a hairline, either we're going to have to use more grafts, which means depleting the donor area further, or we're going to have to give you lighter density. And that was never an option for you. For you, it was about having high density, having a natural looking end result, and position of the hairline is also dictated by where your muscles sit. And you do have fairly high set frontalis muscles, right, naturally. So you have to take all of that into consideration. And when people look at you right now, they're never going to think that A, you needed a hair transplant surgery, or B, that you've had a hair transplant surgery, which is what you want. You've got the Holy Grail.
Exactly. Yeah, and I mean, the conversation makes me think of some other friends or random people that I know that have had hair transplants. One of them was, I hope he's not listening, but he worked at a salon, and I had told some of them, oh, I'm going in for a hair transplant next week, and they go, oh, no way, one of our guys, he had one. And he's like, let me go find him. And I saw his results, and I was a bit nervous after because, he had said he had done 4,000 grafts or even more, and he was doing it in Turkey. It was too big of a square centimeter, right? And so that's when I was really focused on more okay, I fully, at that point I had trusted you because we had it scheduled, everything was settled. But that's for me why I ultimately settled with yourself was the trust, because you're honest, you make your information public. It's not something you're safekeeping, and for me that was honestly one of the big selling points.
Great. Now look, let's talk a little bit about the run up to the hair transplant itself. So you've now decided that I'm the guy. You've obviously had a bit of a temporary wobble because you've seen your barber bring out a guy who's just had 4,000 grafts and he's like, oh, I don't want this to be me. A little bit nervous now. The day of the procedure arrives. How did you? Even the night before, how did you feel?
The night before, I took a video of myself on the photo booth, and it was great, honestly. I felt like this, not everything was leading up to this moment, but I felt excited. You know, I had told like my team, I had the time from working from home in the calendar, and I was ready to get the process started, because I know the aftercare is a journey in itself. But leading into the day, I mean, I was very excited to get it done, because I know you're busy, you have your calendar. We found the day, and leading into the practice, it was kind of fun to shave the head to see where, you know, it's like, it's been a long time since I had shaved mine. But ultimately, I was excited. You know, I wanted to start the aftercare as soon as possible and see the results.
Yeah. Okay, so that's the night before. Then you come into the clinic on the day of.
Yeah.
You know, you was greeted by me personally. Tell me a little bit about the build up on the day, and talk us a little bit about the stages of the procedure. Anything that you found particularly comfortable or uncomfortable? Anything that put you at ease or made you a little bit apprehensive? Tell us a little bit about your journey in terms of the day itself.
Yeah. So the day itself, I arrived at the practice. You greeted me. It was early. Maybe like it was only you and the secretary at the time. And we go down to your office, and this is when you're drawing the official line, right? And this is a big deal.
Yeah.
Because this is this right here, right?
Negotiations happening on your part too.
Exactly.
Yeah.
And so we go to your office, and you draw the line, and I look at it. He's like, I'll leave you with like a couple minutes. I'll come back. Let's make sure that you're happy. Yeah. And I was like, taking photos, you know, just for my own album, of course.
Yeah.
And then I was like, okay, maybe, you know, okay. So you came back, and I go, can we do a little bit more? It looks, you know, I wanted it changed a bit. And you go, let me see. You like raising the eyebrows, the muscles. You go, okay, you know, let's restart. Yeah. And then we drew the line. Okay, boom. Shook hands, signed the paperwork. And then from there, we had gone into the room. That's when the shaving happens. We took a few photos, which I'm sure you'll be able to see. Yeah. And what else happened? I think the lunch menu was set. And then we do the shaving the head, and boom, we get right into it. I remember you had done the local anesthetic, and that was, I wouldn't say it was painful. A lot of my friends, they asked, was the process painful? And I say no. If anything, it was just the first night of sleep was the uncomfortable part, where the anesthetic wears off, and you start to feel a little bit more of the blood coming back. But we do the local anesthetic. It's not painful. It's just like making sure. And
I think you've got a higher pain threshold to other people, possibly from your college football days and things like that. So a lot of people will say it's at least a 5 out of 10 pain. But I remember you were just chill.
Yeah, it was good.
You're like, it was good. Have you done it?
Yeah, exactly. And it wasn't too many, right? It was just like maybe no more than 20 small injections. And then from there, we take time to make sure that it's nice and numb. And you do a couple tests to make sure that where you're extracting hairs and where you're implanting, or no, where you're extracting, because it was just the back first.
Yes.
And then the process starts. You were physically extracting every single one, and you were doing the counting, or let's like realistically counting, and then every maybe like 100 grafts, one of your what would you say, technicians. Yeah. She would take the grafts away, make sure that they're preserved in saline, and then another technician would be looking at to make sure that they're sorted by triples, doubles, and singles. Okay, good. And of course, I'm in the chair, and I'm hoping, like, please, I want a bunch of triples. I want a bunch of triples. And then from there, I mean, that was a couple hours, just to make sure all the hairs are extracted. And you're spreading the grafts that you're extracting. You're making sure that they're extracted from a full playing field, right? Yeah. And then at that point, once the hairs are extracted, boom. Then you get into, there's a small break, and we go into the implanting. I mean, I can continue, but I want to be mindful that there's other. But So yeah, after the halfway point, I think it took a while longer than maybe expected. So lunch was like, hey dude, you got 20 minutes.
Eat quick.
Use the bathroom, eat quick, and then at that point, we do a couple more local anesthetics to make sure that the top of the head is now numbed out.
Yeah.
And then you're doing you're marking, or you're like doing the incisions, right? Doing a bunch of incisions. And then there was also some fluid to make sure that the crown of the head, like you'll see, it's like your head, it swells up only because if it's done correctly, your head swells because they have to put like the anesthetic, and then there's also some kind of like saline, right?
Yeah, very good.
Because you want to make sure that you're able to see the incisions.
Yes.
If it's not, then you're kind of like blind, but you have your binoculars and everything. But
yeah, binoculars.
And so like, yeah, because you see stories from other practices and you get all swelled up for other reasons. I remember I got in the Uber home, and my Uber driver actually had a hair transplant, and I was like, what? But he tells me, you just had one? Like, my head was so much more swollen. My head didn't get swollen. It was just the top that took a minute to flush out because there was extra liquid for the procedure.
And that's important. So we don't over-tumesce so it's called tumescence. We don't over-tumesce the area. We don't try and make your head like a balloon.
Mm-hmm.
I think that's a badly done surgery. Now, there are going to be times where you have to put more fluid in. Let's say a patient's bleeding a little bit more, or they're not getting numb the way that you want them to get numb. Then you're going to have to put a bit more fluid into the head. And then you have to remember, every time you make an incision, you're going to bleed underneath the skin too. So that's going to culminate into having more swelling on the face. What I also try and do is, once I've done my incisions, I try and milk the swelling to the sides. And I did that on you. I pushed it down, moved it to the side, so it doesn't end up right in the bridge of your nose. Unfortunately, some swelling is inevitable. It is what it is. It is what it is. And then, carry on. So then implanting?
Yeah, for the implants, after the incisions, boom, the implants, you do, I want to say like the front line, you're making sure that everything is set, that the incisions were done correctly, and then the technicians in the meantime, while this is all happening, while during the lunch break, they were, organizing all the grafts. And I mean, I think I did like 2,300 grafts or like something like this. And you have to make sure that you're doing the singles in the right area, you're doing the doubles in the right, and like you need to make sure that they're placed correctly.
Yes, good.
So once you had done a few hundred of the implants or inserts, right? Then the technicians take over, and there are two of them going ham on both of your side, right? And they're like putting them in. And I mean, it takes a long time, right? You need to make sure that you're placing them at the right angle so they grow out correctly. And I mean, that was another part of the process. I think I watched the Tom Brady roast on Netflix during that, because it was that happened. Once that was over, I mean, that was a few hours, right? It took me and sometimes it goes longer. And I know one time I had messaged you, and sometimes you need to be more involved on other aspects of the procedure, or sometimes it takes longer to put the hairs back, or you're bleeding too much. Yeah. It's all part of the process. Yeah. And I want to say, what happens then?
You go home?
Yeah, I go home.
You go home.
And you try and sleep. It's tough. But
I think the first 24 hours, I mean, that's a very comprehensive, you obviously lived it.
Yeah.
So but you're also on diazepam at the same time, right? So I think when you go through something like that, you almost remember specific moments of that specific procedure, which stays with you for life. I know you're trying to get into the technicalities of it for explanation purposes, but I think you've summarized it beautifully. I do the extracting, I did the incisions, and I was hands-on during the implanting phase too, which is again why you pay the premium, as I was discussing earlier, right? Yeah. You want your surgeon to not just do certain parts, you want him to be able to do all parts, and you want him to be able to do all parts competently, because if he can't, then what is he training his technicians to do?
Exactly.
And I think that's a very, very good point that you make. So anyway, we send you home. You've got some bandage on the back of your head.
Yep.
You go through the post-op recovery phase. You know, your scabs come off by scabs come off by day 10. You've got a buzz cut style hairline now. How do you feel?
I mean, after 10 days, I would say it took me a while to really feel like, not like feel comfortable, but I mean, it takes a while. So 10 days go by, I was sending you photos and you were messaging me, hey, where's your photo? You know, at 3 p.m., like, come on now, send it. But you were responsive, right? And I was like, I felt bad, like emailing you and saying, hey, does this look normal? But
you shouldn't though. That's what you pay for.
Exactly. And so day 10 goes by, and you have to wash. I think you start washing your hair after day 10 or something.
5.
Yeah, after day 5. But ultimately, I'm there. It's part of the process. Like I think I still had scabs, and you want to make sure you're super gentle with those hairs because the last thing you want is for the grafts to not set correctly. So I mean, it's important that, and you were very open about this, and same with Russ. He's like, you want to work from home for 2 weeks, or for if you can. And I would highly encourage the same, because not only is it good to be able to like get back to a normal looking face, but also you need to take care of the washing, because you're washing twice a day at that point. And even after those 10, 14 days, there are still, for me, there were still some scabs. The hairs were like a bit firm, and I think that's just part of the thing, right? But I mean, leading into like maybe after 1 month, I was still like, okay, what's going on?
Very normal.
Yeah. And so, I mean, if anything, I would explain it as the first 2 months, I was feeling still a bit anxious.
5 months. Come on, Nico. You're being generous to yourself, my man.
I mean, give or take 5 months. Because, and these are things that you've explained. There's the shedding phase.
Dormant phase, nothing happens.
Exactly. And for me, maybe it took longer than what was on paper, which I kind of knew my hair grows slowly, so I knew that it would take longer for the hairs to grow back. Yeah.
But it was a period of anxiety for you.
Yes.
Like, and this is what I really want to hammer in. What I say to a lot of patients, and you are no exception, is I guarantee you after 6 or 7 months, you'll go MIA. Okay? The first 5 or 6 months, you'll be constantly messaging me because the results won't quite be there yet.
Yeah.
5 months come in, nothing, you're not very happy with it at that particular moment in time. I'm not happy, but just anxious, very anxious. Like, is this normal? I'm not seeing a lot of growth. Is it going to be okay? And that was the last email I received from you, I think it was. And I was like, everything's normal, Nico. Don't worry, give it some time, it'll grow.
Yeah.
And I emailed you month 6, like, everything okay? No response. I emailed you month 7, no response. I emailed you month 8, no response. I kept emailing you. And then finally, sort of 12 months after the fact now, you get back in touch. Oh yeah, guys, sorry, I've gone missing. Really happy with the result. It's amazing. And here we are right now.
I know.
And you were no exception. So this is what I'm trying to say, like, I'm almost like people forget. People forget about me, because why would you want to remember the guy who fixed your hair? You see what? In the nicest way possible, right? It's like that, right? It's like, oh yeah, so I had this problem. I paid him well. He's fixed my problem. Why would you go back? Unless there's a problem, you don't need to come back and see the person, right? And I feel that you were no different in that regard. And that, and I always say to Russ as well, sometimes not hearing from a patient is a good thing as well. Right? We'll do our end and we'll still try and reach out. But if you're not available, or if you're unable to respond, it's a good thing. You would let me know had there been an issue before. Yep,
definitely. I mean, I would say because you're exactly right. 5 months go by, like after month 5, then it's like radio silence, because then I for my shoes, I'm like, okay, I could start to see my hair growing back. And over time, the other dormant hairs, they start to grow as well. And that's what I would tell anybody that's doing the process, any friends or like some potential patients, and that's what I was told, but I didn't listen. Right? It's like to be patient, because that's what happens. And of course, like, I'm being very cautious and gentle when I'm washing my hair because it's like it feels weird. But like ultimately, it's just like it's a matter of patience. It's a matter of the process, and that's what you were telling. That's what you had told me.
Yeah.
And it seemed that I had forgotten. But I mean, because it's like I paid a significant amount of money in my shoes, and you want something right away, right? Usually, when you pay for something, you get it.
Instant gratification, yeah.
Whereas this was unique. It's not something, right? So that's where the anxiety came from.
Yes.
But ultimately, I'm pleased.
Yeah.
Thank you.
Thank you. We get nervous as a clinic as well. We're like, he hasn't responded I hope everything's okay. You know?
Yeah.
And it was just really nice to hear you reach out again and just, be like, sorry guys, I've just been really busy. Hair's looking amazing. When can I come in and see Manny? And for me, that made me so happy. I was like, yes, finally, we've got him back.
Yeah.
And here we are doing a video together. Let me show you a picture.
Oh goodness.
And Simon's going to put this one up here as well. But when you see this guy, what do you think?
Yeah, I know. Each time I've come in, I'm like, yo, let me see the photo again.
You almost can't remember,
No.
It's like, who is this guy? This is a guy that had a beard, was hiding under a hat a lot at that time. You had a snapback and you had it on reverse. You look a lot older in that picture, man.
Mm-hmm. I know. Like, and it's only been a year, but I forget. And like that's what I have to remind myself. I'm like, I look at old photos and I go, wow, this is insane. But looking at this, I mean, yeah, I don't miss those days. I don't. But I would if I didn't do the procedure. This is what I think. What I think of is if I had not done the procedure, what would be going through my mind then?
Yeah.
And knowing that it would only have gotten worse.
Yeah.
And for some people, it's not the end of the world. As I mentioned earlier, for me, it was something that I had been thinking about for 10 years already. I think what would I be thinking with my hair even thinner than it would be? And I don't think I would have been as happy as I am now.
Yeah, very good. And I think when you came in and saw me, you said to me, look, Manny, I want it to be age appropriate. I want to have a full head of hair. And above all, I want it to look natural. Mm-hmm. When you look at your hair now, how do you feel?
I feel great. I feel confident. And I feel like I've gotten younger in a way, if that's makes sense.
You shaved the beard.
Yeah, shaved the beard.
Beard is gone.
True. And I know. I knew it was going to be this transformation. But I feel great, honestly. It feels good when I look at the hair, when I feel the hair. And sometimes I still mentally, I can think, I think of myself in these shoes. Yeah. And then I have to, look at myself. I'm like, okay. Sometimes
pretty good.
I have to do that just to remember that, I have my hair back.
Yeah. Yeah, exactly that. Now, thank you. That was a really nice sort of analysis and summary of your overall journey so far. And it's not the end.
Yeah.
We're still talking about adjunct therapies, using medication in particular. Well, let's talk about medication actually. Finasteride. You use finasteride orally. You're taking my personalized protocol for that.
Yep.
Any side effects?
Finasteride, no side effects. No bad. Yeah. One side effect. So when I first started taking it, the procedure was in May 2024, and I started taking finasteride maybe a few months before, just to make sure that it's in your system, to see if there are side effects, right? Because it's something.
It's a good approach,
right? And I think it was maybe 1 week. This is jokes. It was one week after taking finasteride, and boom! Like I woke up. I looked down at my pants and I had my first wet dream. And I swear it was from the finasteride. I'm not sure.
Maybe you were just dating a really hot girl.
And I don't know if it was the finasteride, but I think it was.
That's a good side effect.
Yeah,
I'd take that.
Right? Because you hear of the other side effects. And for me, I started, I took like half of the dose once a week, because I was like, I don't want to have ED, you know.
Yeah, of course.
And it's,
who would?
yeah, irreversible potentially. So I was very cautious.
Of course.
And yeah, fortunately now I do the standard protocol.
Yep.
But yet continuing to do finasteride and some of the other treatments. But yeah, everything so far, I mean, like,
It's good.
Yeah, it's going well.
It's good. Fantastic. And, you know, what's your thoughts on, you know, the hair transplant industry as a whole, having been part of it, having gone through the journey with me specifically? You know, a lot of the time people end up a little scarred or have a jaundiced opinion of the hair transplant sector or the hair loss sector as a whole, because a lot of patients are vulnerable. What's your opinion on this specific niche market?
Yeah, I would say it deserves more positive reviews, right? It deserves more like acceptance. I think part of the reason why I was skeptical was because it was like, it felt like you're changing the way you look.
Yeah.
And that's not something that I felt like I was doing.
Yeah.
So I would say it's a normal thing. And having been through the process, I mean, I'm very pleased. And I know there are some practices that may not be as good, but that was something that I didn't want to explore. But ultimately, I'm very happy. I think the hair transplant community, it should be more, you know, there should be more attention in saying, hey, you know, it's totally okay.
Yeah, yeah. And if you feel bad about it, just do it. Get something, and just do your research. It doesn't have to be me that you pick as a surgeon. Do your due diligence and find the surgeon that's the right fit. A lot of it is gut instinct, Nico. You know, you meet someone and you think, you know what, this is the right guy for me. Yeah. In that specific moment, you spoke to loads of people. You know, other people have spoken to loads of people, but people ultimately, they get a good feeling about someone. When you get a good feeling about someone or something, you should go for it.
Yeah.
That's how I see things. Okay, you only live once. Life is too short. Right, Nico.
Yeah.
If you could give me 3 hairy stories.
3 hairy stories. The one that comes to mind, this was when I had first moved to London, and this is pre-surgery. Yeah. I was out like in Soho somewhere, and I had gone to some some bar, and I was talking with a chick, and she was like, oh, my friends are upstairs. Like, let me go introduce you. So I went upstairs, and like people were drunk. It was fun, right?
Yeah.
And then one of her friends, she was just for lack of better term, she was being annoying.
Yeah.
And she goes, oh, I'll see you in Turkey. I'll see you in Turkey. And I was like, what? She goes, you're losing your hair. Wow. And I was like, oh, damn, you know?
Oh,
like,
wow.
And so for me, I was
like,
like,
something to her as well.
Yeah, I could have, but that's just not who I am, right? I was like, you're going through some stuff. It's not for me. Yeah. So that was one where I was like, really?
Wow, yeah.
Another hairy story, I think I had mentioned earlier, but now this is again pre-surgery, and it was like 2019, and I had shaved my head, and my college teammates, again, you know, they were saying, bro, like, your hairline's receding, man. And so I was like, oh, really? Like, how can you tell? So just like stuff like this, of course, like you got to be able to take the banter.
100%.
And then one after surgery, I would say it's mostly like, there are several, but it's the friends that I've told, the friends that know, because as you said, like you can't really even tell that I've had the hair transplant. But friends that do know, they're like, Nico, like before you go any further, I just want to say your hair looks so good. Like, they're like, dude, Nico, your hair looks really good. And I'm like, really? I start blushing. Like, I don't know how to take I'm not used to getting the compliment on the hair, so.
On other things, yes, just not the hair.
Yeah, exactly. Yeah, this is new to me. So I mean, those are a few, and then even like, I think another time, it's more the compliments that I'm just not used to. Yeah. And at the time, my hair was a bit longer than it is now, again, like post-surgery, post-procedure. And it was a friend's wife even. She goes, "Damn, Nico's hot. You know, Nico with the long hair, he's hot." And I was like, "Dude, like, you're married to my friend." I mean, we're all good friends, so it's like it's no harm done. But I mean, So I would say a couple before, a couple after,
that's cool,
and
man.
total opposite ends of the spectrum.
That's really, really cool. That's really, really cool. My man, it's been an absolute pleasure to have you here again today. We're still going to be in touch for many years to come. I hope that we can keep you out of the chair for as long as possible. You know, we've got you on a protocol. I mean, we were just talking about it earlier. The John Cena, he's on some form of protocol. And so you wanted to pick my brain about my protocol. So we've got a plan for you moving forwards. And, you know, we'll see what the next decade or so has to hold for you.
No, of course. And I still owe you the bottle of whiskey.
You always come empty-handed, my friend. It's okay, but you come with good vibes, so it's all good. Everybody's going to think I have an alcohol problem. I really don't. I just like a sip of whiskey every now and again. Listen, guys, it's been an absolute pleasure having Nico on the podcast again today. And, you know, I look forward to sharing more stories like this with you in the future. If you found today informative, enjoyable, educational, please like, share, and subscribe. It means a lot to us and the channel. Thank you very much. Till next time, I'm Dr. Manny.